Good morning, everyone. Let me ask you a question. Who are the ones who have been at any point been exposed to some kind of discrimination because of the work we do on the sexual health side? Raise hands. I want to see this. Up, up, up. Okay, that's good. I'll connect this at my last slide, how it's going to. And of course, I have shared some of my work, and I'm going to share the same story with a very different angle, which is very close to my heart. So I was very looking forward to this talk. So a little bit of myself, I'm a physician. I'm an ER physician, and I'm an engineer too. I code, I have engineering background more than the medical background, and I have technology patents. So I wear two hats, which is engineering and medical in the same head. So I have a lot of perspectives, context to give on this topic. And one of the biggest reasons why I left academia when I was a physician and a university professor is because I felt there was limitations in the academia. Of course, I'm not saying academia is bad, but it has to be a combined effect, different point of views. So I thought, how about I step it out and bring a little bit of different point of view. Same time as a startup, I can move faster. At the end of the day, I'm the boss. So I can decide what. I don't have to ask from my university to give me the permission. Yesterday I shared, we did the project for Mpox to detect in 2 months, and the paper itself took 2 years to be accepted and published. So this itself is kind of a discrimination. And main author Rainer is in the audience, and we were laughing at it. BMJ sit for 18 months and come and say, sorry, we cannot because of some internal problems, which I'm not going to go into details. So that's why I'm very personally connected to this topic. So these are my disclaimers. Of course, I lead the HeHealth and some academic portfolios still. So what does the stigma means to you? So it actually can mean a lot of things, but simply put, if you are perceived as different or deviant from some way, in a way what we do in the sexual health is always considered as different, then you will be often lead to discrimination, prejudice, and social exclusion. You will be pushed out of things. You will be tell like, oh, this is rubbish. You're doing something not right, kind of thing. I'm a physician. I've been trashed many times saying that I work for sex, and sexual health and sex is very different. Again, I come from medical point of view, bringing the technology, how we can improve that. So I'll start again for the importance of this story where I started HeHealth, and that's where the stigma comes in. The stigma is at the core of the HeHealth that we do. In 2019, I get a message from one of my friends asking, just not asking, saying, thanks for being a good friend. Me as a physician, I have seen this kind of text in suicidal notes multiple times. And guys don't message like that, believe me. So I immediately rushed to his house, and I was right. He was in the 8th floor balcony about to jump. Long story short, I bring him in. I asked what happened. He said, I have HIV. I was like, wait. I was his physician, so I know his HIV status, which was negative. Of course, he could have get it later, but I asked, how did you get it? Did you have blood tests? He said, no, I don't have blood tests. Then I was like, wait, how do you know you have HIV? Oh, I had unprotected sex, and after that, I realized there's a rash on my penis, and I Googled, and I realized I have all the symptoms of HIV. For me as a physician, I was like, dude, that's not how the science works. That's definitely not how the HIV works for sure. But he couldn't get the information because he was a married guy. Clearly, he couldn't tell his wife, he couldn't tell his family, he couldn't tell even me because he thought I will judge. That was, I asked like, you could have asked me. He said, no, you know my family. The first thing you will, they said, like, how can you do this to your family? I said, no, I'm a physician. It's not my duty to judge. I treat prisoners who have killed people. But again, it's not my duty to judge. As a physician, I said, I would have helped you. And because of the stigma, everybody is pointing the finger at him. He rather choose to die than asking people for help. That's the stigma and how strong it is. I have seen this many, many times. So honestly speaking, I think technology is the best way to get this out. So when we started this, so we did research on Reddit. There's a subreddit called /STD. There's more than 10,000 people ask about STIs and sexual health in this Reddit. And we as physicians, we analyze this data. We analyze close to about 1,000 posts. we realize about 60 to 70% information is completely inaccurate, medically completely wrong. So it's like a one blind guy asking another blind guy, how does the elephant looks like? The first blind guy touched the elephant's leg and say, oh, I think it's a cylindrical. The second guy maybe touched the ear and say, no, I think it's completely different. So people who have no clue what medical aspect of STI, giving advice to each other, and it's quite sad. We are living in an age where the mobile access, internet, and AI is at your fingertips. How can people cannot get the information? My topic is the stigma-free access, right? So I'll come to that. So what we did is, we built HeHealth, which is at the first step, it's a simple penis health tool. If you see something like what my friend said, you see a rash or something, you can upload a picture, answer a few questions, and you can get personalized information immediately. But again, I talked about the technical part yesterday. I want to talk about the stigma part. So when we first launched the MVP, there were 20,000 downloads immediately without marketing. So we go back and ask, we actually interview more than 2,000 people through email. Surprisingly, most of the other emails, people will not respond. Our one, we were actually targeting 500 people. 2,000 people replied. I had problems analyzing the data. I was like, how am I going to analyze? Lucky the AI come to rescue. So the first feature we ask, what is the most important thing you like about our tool? There were many other tools, right? Why HeHealth the penis app? What was the main reason? Can someone guess what was the reason? It's not the fancy AI for sure. Let me point at least some to try to get everybody awake. Guys on the back, what do you think? Yes, sir. Do you mind? Yeah. Do you mind telling me what do you think is the main reason why people would use this kind of app? Yeah? If you don't mind? It's okay, no problem. I'm not going to point. So the number one reason people say why they use the app is the anonymization. We did not ask any name, phone number, or email at all. Completely anonymized. They said, we feel invisible. So my personal attachment to the society is not there. Nobody is pointing the finger, hey, Yudara is checking STI test, like, wow, I saw him in the STD clinic. No, there was no person. When you remove that part, people are willing to understand about themselves. Ask that question which my friend chose to die because he was not willing to ask that question. That was the number. So it's not the technology per se. It's the how we deliver the technology to the people which makes the difference. So that's how I think we need to make changes to the technology, which I'm going to come. Just the scientific part, we have actually worked with Harvard School of Public Health and University of Southern California to document these things and publish, just to show that AI is actually capable of managing things. So even in the sexual health, so this app managed to detect physically recognizable symptoms 94% accurately, which is far better than a normal doctor in a clinic of most of the places. And WHO itself say the general physician's accuracy, not infectious disease, is about 50%. Clinical accuracy is about 50% for STI. Okay. So also we did some work on the Mpox. Again, same thing. Mpox was affecting the MSMs. Again, it's not STI per se. There are many other ways you can spread the disease. But the new wave was focusing on MSMs. So because of the MSMs, people are not willing to ask that question or getting tested. Of course, when you don't get tested, it gets more spread. So again, where's that information flow, right? If there's any way we can get the information to the people, then people would have listened. But kind of society itself is pushing against that information flow. And we build a digital app which you can upload pictures and answer a few questions. Stanford University, another team did the same thing. We concurrently did the projects. And both clearly shows that up to 90% you can detect things digitally. Again, let me share a story. I had this patient come to emergency department with his wife and kid, a 2-year-old kid. And I was in the adult side, and I covered the pediatric side too. Pediatric doctor called me and said, I have a hand-foot-mouth disease patient. I said, okay, just treat. And adult side, my junior doctor come and said, I have this patient who have a rash on the leg, which is very weird looking. Can you have a look? So as a consultant, I only go and see if junior doctor is not so sure. So I go and examine this patient, and he was wearing a short, and he have some rash, which is looks like a chickenpox kind of rash on the back of his thigh. So I asked what happened. He said, oh, actually, we went to Paris, my whole family catch chickenpox. So my wife is in the department, she have chickenpox, and my daughter have hand, foot, mouth disease, and I have chickenpox also. I was like, wait, that doesn't sound very right. I asked, at that time I didn't think about it. When I examined, the rash is appearing more towards the buttocks. So I asked, is it okay I bring down the pants and check? Then I realized it's focusing around the anus. Then I was like, look, this is not chickenpox, this is monkeypox. Then when I confront him, he was immediately, sir, please, I will die. Do not tell that I have chickenpox. Then I said, it's okay, I will respect your privacy. Of course, there were some rules I had to follow, but I can find a way. So he finally said, we went to Paris, my boyfriend is in the Paris, but I'm married, I have a kid. So I would rather die telling that I'm a bisexual than getting this tested. So that's why I didn't want to come at the beginning. So you can see, but when I give the information clearly and tell them what to do and what not, he was willing to listen all the way. But the part where he prevented this, he didn't know, because the information flow was not targeted. But now the technology is there. So again, our monkeypox tool is completely anonymous. Our monkeypox tool is the most adopted in US at that time, because same reason. We didn't collect any personal information at all. So when the person removed from the equation, people feel comfortable. So now moving to the next part. I'm definitely going to push a few more minutes beyond my time, because it's such an important topic to me personally. So when the OpenAI came 2022, surprisingly, the CEO itself is someone who belongs to MSM community. They still blocks a lot of sexual health sexual health information. Out of all the LLM big players like Gemini, Meta, Anthropic, at least OpenAI is the one which have little bit braveness to give information when it comes to sexual health. It puts things which I will share later, but it will still give. If you look at Gemini, ask a sexual health problem. How does a normal person, a commoner in the society, know how to ask a question? Like my colleague said, the key limitation is that it's about the question you ask. But what if you don't want to be based on how you ask? AI can gather the information itself. That would be the idea. Again, I'm coming back. But if you ask anything in Gemini, it'll immediately block you and say, sorry. Most of the people would say like, oh, they don't know how to ask, even say my penis. They would say like things like my dick. And then it'll block and say, sorry, I cannot help you. And that kind of information. So we are moving into an era where the information is very accurate, precise, but when it comes to sexual health, it's completely blocked. So how does this information equality comes in here? So that's the part we need to fight. Again, at least OpenAI is brave enough to give some information. I'll show you. So I asked like this question. I had sex with someone. This is how general people would ask, right? Because they don't know the medical terms. And then immediately, this content violates my policy. That's it. But OpenAI still give you the answer, little bit, not the full answers, but little bit. It says, go help you seek. And I was preparing my slides. I do it in Canva. So there's this thing called Magic Write. I use that. So when I ask, I say, hey, can you write that topic? It says, sorry, I cannot help you. So whenever the sex is mentioned, blanketly everything in the society, they try to push it towards non-accessible. So I think that's where we need to be fighting against. Okay, this is the most interesting slide in my talk. So when I launch these things, again, I thought I step out of the academia because I want to show that there's a different way. So I immediately bring the products to the people and then let them use, gather the information, document it in a scientific way, we publish the papers and so on and so forth. But I think we, by single-handedly, caused the most global attention on AI and sexual health. My work got mentioned so many good and bad. Some people like, who knows tonight's show by Jimmy Fallon? There's 100 million views every single episode. The only thing he have to say about HeHealth is, at least I'm glad he picked it up. So there's 100 million views immediately, but he make fun out of it, you know. He said, oh, there's an app for the penis, ha ha ha. And who might be guys who sending this penis pictures to the app, so and so forth. He didn't even bother to look at the scientific part of it. He make a joke out of it. There were many things. BBC talks about it, and I was so shocked. It was shared by a doctor herself, and she shared a lot of wrong information itself. So why this wrong information? Why the correct information is so hard to get it out? Of course, there were many information articles talk about the right thing, the need for it, and so on and so forth. But society, when it comes to the sex, is always divided, right? So there's always a part where people trying to kind of suppress it. And many people, you'll be surprised. I get almost messages in Instagram and other social media profiles scolding me. Some people said, oh, you're making sex easier. I said, no, I'm not. I'm empowering the people to make the right choice. It's very different. So I have no judgment on sex, but I'm empowering the people. Previous talk, Reina was asking about why we are not willing to accept that we can empower people to make the right decision. I think when you put the machines into the equation, we can now. So previously the stakeholders was governments, the doctors, the policymakers. Now for the first time, when the machines are there, they are a new stakeholder, actually can guide through these conversations and make a part of this thing. So, but we need to get this right, otherwise the machines will be biased and the bias will be amplified. I'll share a little bit about our current work. Again, try to keep everyone awake. Who knows this movie Frame? Surprisingly, yesterday when I asked, nobody knows. I felt so old. Yep, it's Matrix, the original Matrix, I think about 15 years ago. And these are called the Matrix agents. And the big bad guy is in the middle. So what if we can actually create AI-driven agents like people who can help you through the whole spectrum of the sexual health journey, the education and so on and so forth. We did that. So this is, of course, in the R&D level, we have not released, but parts of it we are actually releasing to the public. So I ask, this is a chatbot which is driven by agents. So it's very different of anything you have seen. I'm sharing this for the first time with the world. So I had unprotected sex before, and now I have a discharge from my penis. And it comes back and asks the questions to understand your problem. This has never happened before. You ask a question, it gives you an answer, that's it. But AI is not capable to understand more. In this one, it comes back and asks questions. When did you have sex? What is the discharge? Is there pain? Is there anything else? Did you have the accident? So I give you all these things. Not only that, I said, oh, look, here's a picture of my discharge. It can analyze all these things. If you look at the third screenshot, the image you provided showing penile discharge, I'm concerning that it's STI. Given the appearance and description you provided, it most closely resembles gonorrhea. And it tells you what is gonorrhea and how it be tested, how it's been treated, and it tells you what is the next actions. Go see a doctor, get it tested and treated, avoid sex, and of course tell your partner. This is true empathy showcasing, and we have not hard-coded. I actually show more examples yesterday, but when you have such a situation where it can manage, when you go to a doctor, if you are MSM, the doctor might roll eyes. I have seen this many times. But if it's AI, it will not roll eyes. It will still have that same empathetic tone and communication with you. And again, people might not feel that you've been judged. So we are incorporating these technologies into the world level, WHO, government levels. I'm working with some of the governments around the world for sexual health education, pre-consultation screening. Again, we have done a lot of work on here. If the pre-consultation is done by a nurse, people don't feel like telling everything they have done. But if it's an AI bot which can gather the history, people feel very comfortable. And a lot of people willing to tell everything they have done so that they know that there's no judgment. And of course, to follow up on the consultation and so on and so forth. Again, what we have done here is to train specific agents with a specific task. Agent means they are actually not only able to question and answer, but they are able to follow up and do a task. So we have diagnostic agents, we have treatment agents, we have follow-up agents, and so on and so forth. So finally, we are coming to a point, not what if, when we can replace some of the humans who are involved with these care pathways with the machines, people will be more comfortable. The stigma will be much, much lesser. So I have to make a bold claim today. So I think at the end of the day, when humans are involved in care pathways in sexual health, there will be stigma. I think now for the first time we have a second option, breaking barriers with the machines, stigma and discrimination-free sexual health, information and care for all, using machines. We are at the age where we can finally bring that next option. So I'm super excited. I'm leading this work, and anyone who wants to know more about this work, I'm always available. You can find me in LinkedIn. Drop me a question. I'm very happy to talk about it. Again, we are first time ever, more than humans, a capable hand, same empathetic way, without stigma, bring that information to the people who need. A machine is already there. So I think, no matter how much we talk about it, I'm bringing that perspective. I'm bringing that context, giving that option. Not only humans, maybe machines also can do a good job here. Thank you so much. And this is something which is very close to me. If anybody wants to talk to, ask questions, I'm always outside after the tea. So come and look for me. Thank you.